जिम्मेदारियां होती हैं, लेकिन जो कुछ आजकल के हालात चल रहे हैं, मेरे ख्याल में आप सबसे ज्यादा मसरूफ हैं और आपने हम सबको घर में बिठा दिया है।
नहीं नहीं, ये तो वायरस है ना, it is a risky virus, so it's important to stay at home, but equally हमेशा तो लॉकडाउन में रह नहीं सकते हैं, so कम तो हो रहा है केसेस, लेकिन फ्लेयर अप्स भी होते जा रहे हैं हियर एंड देयर, so
लैंकाशायर की क्या पोजीशन है इस वक्त?
क्या चीज? सॉरी,
लैंकाशायर की क्या पोजीशन है?
लैंकाशायर की पोजीशन जहाँ से हम शुरू किए हैं वहां से तो कम हो गया केसेस, लेकिन देयर आर आउटब्रेक्स, लाइक इन केयर होम्स में आउटब्रेक्स अभी भी हैं, and different districts are affected differently. पेंडल में भी cases हैं, लेकिन कम हो गए हैं, लेकिन we have to be very careful now. हाथ धोना है, 2 meters distance रखना है, और मास्क पहनना है बस में जाने तो, और any enclosed spaces, it's really important. सबसे ज़्यादा इम्पोर्टेंट है अगर किसी को तबीयत ठीक नहीं है, कॉफ है, फीवर है, लॉस ऑफ सेंस स्मेल, हमें टेस्ट तो करना ही पड़ेगा. वी हैव टू स्टे एट होम एंड गेट इट टेस्टेड, एंड देन द कॉन्टैक्ट ट्रेसिंग जो हो रहा है ना, तो whoever is positive, we are contacting their contacts and providing them with the advice. So ये अगर फॉलो करेंगे तो पैंडेमिक से हम बाहर आ सकते हैं quickly. So that is the important thing now, and also we have to make sure that elders who need support, उनको भी support करना है, और we can't be staying at home forever either. It is important to go out and about, have our exercise, and those are the things that really are important now during this pandemic.
Yeah. What is the position for schools now? Are they ready to go back to school, children, or are still there are some concerns?
Yes, yeah. Generally speaking, schools are much safer, and there are a lot of things in place to safeguard our children, and also protect them from the virus. But if there are any cases in the schools, the head teachers, they have got protocols in place that can protect that specific bubble and do the tracing. We have got more tests than we have before, so schools are opening for more children, and our aim is to get them open by September for as many children as possible.
Achha, just there is bit of easing of lockdown. Last Saturday we saw, हमने देखा कि कुछ दुकानें खुल रही हैं, रेस्टोरेंट्स खुल रहे हैं, और कुछ जो दूसरी जो बाजार में लोग अब आहिस्ता आहिस्ता निकल रहे हैं, लेकिन लोग डरे हुए हैं. अब वो रौनक नहीं है, वो लोग उतने नहीं आ रहे, तो उनके लिए आपकी क्या एडवाइस है?
एडवाइस है कि it is important to go back to or at least open the shops as much as we can. But it is equally important to open them safely. So that is why restaurants में screens हैं, or the arrangement of tables are different. We can't have as many number of people as we have before, but we can't be in a lockdown for ever either, because the impact on jobs and mental health is in a longer term. It's not good for our health. So our advice में हम तो business के साथ काम कर रहे हैं, making sure that they have all the support to open the shops safely, and at the same time protect the customers as well. So the responsibility तो दोनों के साथ है, businesses as well as customers. But it is important to open the businesses. We can't keep the shops closed forever, can we?
बिल्कुल. और लगता है कि आहिस्ता आहिस्ता जो है वो जिंदगी मामूल पे आने लगेगी. ज़ाहिर है मसाजिद और रिलीजियस प्लेसेस, गुरुद्वारा, मंदिर, चर्चेस और सिनेगॉग वो भी खोल दिए गए हैं, और फॉर मुस्लिम कम्युनिटी टुमारो इज द बिग डे, इट्स फ्राइडे प्रेयर, तो उसके लिए मसाजिद doing really well because at the moment जो है ना उनकी थ्रू वो जो भी प्रिकॉशन हैं जो भी गाइडलाइन है उसको फॉलो कर रही हैं लेकिन कुछ डर है कि फ्राइडे प्रेयर जो है उसमें ज्यादा लोग आते हैं तो इस हवाले से आप क्या कहना चाहेंगे
हाँ this is an important area I know all the masjids they have got things in place to keep people at distance as well as facilities for washing hands and so on and that guidance should be followed and if you are having fever or cough or symptoms you should avoid going into those places that are crowded and also elderly who very old people who may have been shielding they need to be very very careful going to crowded places because they still are very vulnerable and can be affected so that is why the guidance is already there Lancashire Council of Mosques and Muslim Council of Britain they have produced guidance and we support that and also where it is needed we are going to plan for testing in the community and that is a very welcome development for us and we will be doing that so we can pick things early people who are symptomatic they may not some of them are finding it difficult to go and drive through to the testing and there will be testing more and more available in the community as well so those are the things that we are working on but
कम्युनिटी में जो टेस्टिंग की आप बात कर रहे हैं तो इसमें कैसे होगा कैसे कम्युनिटी में आके लोगों को टेस्ट किया जाएगा थोड़ा सा इसकी वजाहत कर दें एक्सप्लेन कर दें
so there will be mobile units अभी भी है वो as we go into the future we want to work with the community and maybe put the location where it is more suitable for people and also we want to work with the community itself ourselves so that there are different ways of getting the tests to our people that are finding it difficult to get the tests तो वो तो अभी planning stage में है this will be in effect in the next within the next month we will have more information and we want to engage with the communities in designing that it is not just bringing the tests to the community it's also working with the community and understanding there are barriers there are differences so we need to understand and then take the guidance and steer from the community and work with the community to get the tests where it's most needed those are all the things that we are planning now
अच्छा क्या प्लान है क्योंकि जाहिर है कुछ लोग अभी भी डरे हुए हैं कुछ लोग जो वनरेबल हैं वो बाहर नहीं निकल पा रहे बेशक कुछ रिस्ट्रिक्शन जो हैं वो कम हो गई हैं या खत्म हो गई हैं इसके बावजूद तो it will have a major impact on their mental health and well-being तो उस हवाले से क्या एडवाइस देंगे कम्युनिटी को
नहीं तो ये तो very important we have got lots of people many of them are elderly who have been shielding they've got conditions of shielding or they are really डरे हुए हैं but generally the cases have come down तो ये डरने की बात तो है थोड़ा सा but लेकिन the number of cases have come down and it is important बाहर जाना है एक्सरसाइज करना है फ्रेश एयर लेना है तो ये सब तो वेलबींग का वेरी इंपॉर्टेंट एस्पेक्ट्स है so if you have been shielding the guidance are changing from the 1st of August you can go out but still be very careful if you go into on a bus wear a mask continue to wash hands and there are in our culture there is a lot of family gatherings and household gatherings so we have to be very careful not to forget the distancing and this virus is still there abhi bhi 10% of us have been infected so there's still a lot of people that are still very very vulnerable and susceptible to the virus but we have to try and get back outside and back to normal as much as we can but in a safe way that is the focus
recently लेस्टर का जो केस सामने आया है वहां पर लॉकडाउन जो है दोबारा करना पड़ा तो क्या ऐसा मुमकिन होगा कि क्या हमें भी इसका कोई डर है कि लैंकाशायर या ब्लैकबर्न या नेल्सन या प्रेस्टन किसी टाउन में ऐसा हो सकता है
well आज की बारे में आप भी द नंबर ऑफ केसेस अगर आपको देखें वेबसाइट में, लेस्टर इज फार हायर than any of our places.
Mhm.
What we will see is there will be outbreaks, there will be local flare-ups, but that is why we need to prevent getting into a situation like Leicester. But that only can happen if we all do our part for our place. So abhi to Leicester is very high number of cases. We are preventing that situation. We are constantly watching the number of cases, and we are acting early. Blackburn, Pendle, we are all working with the local area, our professionals, our team members, and with the communities. We are trying to prevent a situation like Leicester. That's why it is very important. Wearing a mask and 2-meter distance, they're all very important to prevent a Leicester situation in Lancashire.
Absolutely. अच्छा, ये बताइए कि ज़ाहिर है we as a community, जो साउथ एशियन से हमारा तल्लक है, जो हम बैम कम्युनिटी हैं, वो ज़्यादा वनरेबल हैं. एक तो सेहत के हवाले से कि हम लोगों में डायबिटीज़ ज़्यादा है, दूसरी जो सेहत की बीमारियां ज़्यादा हैं, हम फैमिली में रहते हैं, इसके साथ साथ जेनेटिकली भी हम प्रोन हैं. और अगर फिगर को देखा जाए तो बहुत से डॉक्टर्स और फ्रंट लाइन स्टाफ जो है वो भी अपना था, और कई लोग जो हैं वो कोरोना वायरस का निशाना बने और उससे अफेक्टेड हुए, और उसकी वजह से फैमिली अफेक्टेड हुई. तो इस हवाले से हमें क्या एहतियात करनी चाहिए और क्या एडवाइस देना चाहेंगे अपनी कम्युनिटी को?
अपना कम्युनिटी तो ज़्यादा अफेक्ट हो रहे हैं. बहुत सारे रीजंस हैं. और ऑक्यूपेशन, frontline facing, and also the chances of meeting others higher. And जैसे आपने कहा family के साथ रहते हैं. So these are all parts, but we also have the risk factors like diabetes ज़्यादा हैं हमारी community में, other long-term conditions भी ज़्यादा हैं. So these are all making people more vulnerable to the virus, like any other disease. तो इसका एक स्पेसिफिक रिस्क असेसमेंट है. अगर आप चाहें तो वी कैन शेयर द इंफॉर्मेशन. रिस्क असेसमेंट फॉर BAME communities, particularly health workers and also all the frontline workers. Employers तो करते हैं, तो we have to ask for it if it is not being done and get the risk assessment. So उनके personalized risk assessment होता है. तो if there are any adjustments that we need to make or personal protective equipment हो, वो सब तो दिए जाते जा रहे हैं. So that's an important aspect for a BAME community, and we have to be extra careful because BAME community is affected more than other communities, and that is why the risk assessment is important, and also our living conditions. If we have got an existing illness like diabetes, you get reviewed and checked. Make sure we follow the medications, as well as general health. Eat healthily, and use exercise, and all that is very important, particularly for people in the BAME community.
Absolutely. No, I really appreciate just bit of interest. How long you been with Lancashire County Council, and just tell me more about the role of Director of Public Health, ताकि हमारी कम्युनिटी को थोड़ा सा अंडरस्टैंडिंग हो जाए कि आप जैसे लोग जो काफी सीनियर पोजीशन पे हैं वो क्या काम कर रहे हैं.
अच्छा, मैं तो लैंकाशायर में 2005 से काम कर रहा हूँ. वेरियस रोल्स, जूनियर डॉक्टर था, अभी डायरेक्टर ऑफ पब्लिक हेल्थ हूँ. Basically our role is to protect the health of the people and prevent illnesses happening. So we look at various factors. First of all, we understand the health of the population, understand the culture, and we commission a range of services, health visitors, school nurses, stop smoking services. Our main role is prevention. Abhi coronavirus pandemic mein very important public health response. It is about protecting the health of the people, preventing the diseases happening, and stopping the transmission of the virus. Very small specialty. So I've been the Director of Public Health since 2013 for the County Council. Before I worked with the NHS. So my role is in a leadership role, working with my team to understand the health issues and then work with other partners, districts, voluntary community faith sector, NHS, and there's a range of partners we work with to keep our community safe and well. That is our role. It is a very small team, so you may not have come across us, but we are working hard in the background to come out of this pandemic and keep Lancashire safe and healthy and well. That is our role.
So this is probably the biggest challenge, since you started, or for Lancashire County Council since its existence, because this is quite a major challenge for all of us, isn't it?
Absolutely, it is one of the major civil contingencies of response. It's a partnership response, police, ourselves, NHS, districts, a range of partners working with us. We've not had it certainly since in the last 100 years. This is one of the biggest crises that we are in, that has gone on for such a long time. And the impact this is going to leave is also going to be for a long time as well. It's not just health, economy be affect ho raya, or long-term health be important hai isme, mental health, social isolation, all of these are very important. So this is one of the biggest responses, public health responses that we are all involved in. The last one, I think, the bigger one was probably polio eradication. That was in India. And this is definitely the biggest one for Lancashire for me.
So, इंडिया का थोड़ा सा बताइए कि इंडिया में आप क्या काम करते रहे और किस इलाके से आपका ताल्लुक है?
अच्छा ना, इंडिया में तो मैं साउथ से हूँ. केरला में काम किया था, तमिलनाडु में जन्म हुआ है, स्कूलिंग वहाँ किया, मेडिकल कॉलेज वहाँ गया और दिल्ली में काम किया 3-4 साल और उसके बाद यहाँ पे शिफ्ट हो गए. अभी 2004 में आए ना, सो फर्स्ट जनरेशन माइग्रेंट्स. और जूनियर डॉक्टर से शुरू किया, अब कंसल्टेंट बना, फिर अभी डायरेक्टर पब्लिक हेल्थ में हूँ.
बहुत जी, हमें बड़ा फख्र है कि आप जैसे लोग जो हैं वो कम्युनिटी में एक अच्छी पोजीशन पे आके, और फिर दूसरा ये है कि आपको वो एक्सपीरियंस भी है इंडिया में अपनी कम्युनिटी का, और उसके साथ साथ जिस तरह आप डील कर रहे हैं वो बहुत अहम, ये एक चैलेंज भी है और इस वक्त की ज़रूरत भी है. तो जो सबसे अहम मसला इस वक्त ये है कि बहुत सी कम्युनिटी जो है वो जाहिर है अब कोशिश कर रहे हैं और आप भी कोशिश कर रहे हैं कि आहिस्ता आहिस्ता हालात बेहतर हों, बैक टू नॉर्मल चीज़ें हों. तो क्या वाकई हम बैक टू नॉर्मल जाएंगे या नॉर्मलिटी बड़ी मुश्किल है, हम कोई नई नॉर्मल लाइफ गुजारेंगे अब?
तो आप तो सब सोच रहे हैं कि नॉर्मल क्या है. That is a bigger question. We will go back to normal. The virus is a new virus. It will take time for us to even fully understand the virus, हमेशा हम सुन रहे हैं कि नई चीज़ें हैं वायरस के बारे में. It will take time. So we have to start learning to live with the virus for some time, at least for the next few months. But it is coming down. The number of cases तो कम होते जा रहे हैं. The tail end is a long tail, so it will take some time for completely getting out of this pandemic situation. That's why learning to live with the virus is becoming the norm now. We will be in this situation for at least for a few months, but the number of cases will come down. We will slowly adapt and start to live with the virus better. That is how it looks to me.
अच्छा, कुछ लोग ये भी प्रेडिक्शन की जा रही है या तैयारी की जा रही है कि विंटर में जब फ्लू होने लगता है, तो क्योंकि ये फ्लू लाइक सिम्टम्स होते हैं, तो विंटर में कुछ लोग तैयार हो रहे हैं, कुछ डर भी है कि ये शायद विंटर में वापस आ जाए. तो क्या आप इसके लिए तैयार हैं और आप समझते हैं कि ये शायद पॉसिबिलिटी है कि विंटर में हमें एक और फेज देखने को मिले?
हम सब चाहते हैं कि ऐसे नहीं हुआ, लेकिन it is entirely possible, and that is why next 2-3 महीने is very very important for us. If we can continue with what we are currently doing to keep the virus down. Winter में तो हर साल होता है ना, winter में flu तो आते रहते हैं, उसका भी vaccines हैं, so we need to get the vaccines all in time for everybody. उसका तैयारी भी होते जा रहा है अभी. But if we take enough precautions ourselves and if the businesses are all opening in a safe way, cases तो कम होते जाएंगे. Or even if they come up slightly higher during the winter months, it won't be like what we saw during the peak, in March and April. So uska tayari to hum kar rahe hain abhi. That is why again and again I am reinforcing the message that to keep ourselves safe, we need to continue to maintain the hygiene, hand washing, maintaining the 2-meter distance and wearing a mask. But also very importantly, when we are having symptoms, cough हुआ है, बुखार हुआ है, तो we have to get ourselves tested and follow the advice from the test and trace program. Only by doing this we can manage the winter well. Otherwise, it will be difficult. So that उसका तो अभी planning हो रहा है winter का already. But we will, if we follow the advice, then the winter will be easy for us. If we don't, then it will affect more. So that is the situation.
और एज ए डायरेक्टर ऑफ पब्लिक हेल्थ, मेरे ख्याल में आपकी जो मसरूफियात हैं या बिजनेस हैं वो मेरे ख्याल में इन दिनों में सबसे ज्यादा है, बल्कि आप मेरे ख्याल में मीटिंग्स एंड बिजी. तो कैसा एक नॉर्मल डे आपके लिए कैसा होता है? जस्ट गिव अस बिट ऑफ एन आइडिया.
नॉर्मल डे आज अगर आज का देखें तो इट स्टार्टेड विद द टीम मीटिंग, अंडरस्टैंडिंग द सिचुएशन अभी लंकाशायर में पूरे ऑल द डिस्ट्रिक्ट्स में कैसे है हालत, एंड देन वी वर्कड ऑन गेटिंग अ प्लान फॉर टेस्टिंग, and I did a few media interviews, but also planning for the next stage. We then reviewed the situation again this afternoon about outbreaks kahan hai, kahin schools mein how is it affected. We've all got a plan now for every situation, so I was reviewing that today. Long days these days, but it is our role, to keep Lancashire safe and to keep Pendle, Burnley, Rosendale, East Lancashire safe. So that is what our main job is, and at the same time, responding to people's concerns and getting the message out that it is important to go out, it is important to get our businesses open, but it is also important to do that in a safe way. So my days are very, very packed these days, but it is a pleasure and it's a privilege to be serving the people of Lancashire in this role. So I enjoy that.
Absolutely. So without taking much of your time, finally, मैसेज क्या होगा हमारे जो बहन भाई इस वक्त आपकी बातें सुन रहे हैं और ख़ास तौर पर उनको फिक्र है, एक तरफ से एक्साइटमेंट है कि थोड़ी नॉर्मलिटी आ रही है, दुकानें खुल रही हैं, रेस्टोरेंट खुल रहे हैं, जो मजहबी इदारे हैं, ये सेंटर्स हैं वो खुल रहे हैं, स्कूल भी सितंबर में स्कूल विल बी सॉर्ट ऑफ रफली बैक टू नॉर्मल या अभी कुछ फाइनल नहीं हुआ?
नहीं, जो सारे स्कूल, that is the plan to be opening the schools is the plan. तो हर एक स्कूल भी उसका ये प्लान कर रहे हैं अभी. My message है कि we should all be excited that the virus levels are overall going down, but we should also be very, very careful to keep it that way. To wash hands, watch the 2-meter distance wherever possible, and if it's not possible, then be very, very cautious. Masks and screens and so on. Follow the advice, and if you are symptomatic, please get it tested. Please get yourselves tested. That is the only way that we identify the virus, and then we break the chain. That is my key message.
And with that lovely message, can I just say a sincere thank you for your time. I know it's one of the busiest time and you need to probably have a break, and we didn't give you any break at all. So thank you very much for giving us up-to-date information about Lancashire County Council and surrounding area, and talking about your role and talking about some key messages to the community. So really appreciate. We will probably invite you again to just get some update, but you can have a bit of rest now. So Jazakallah, thank you very much for coming, and you look after yourself and take care.
Thank you. It is my pleasure. Thank you.
थैंक यू, थैंक्स वेरी मच। और ये थे हमारे आज के मेहमान जिन्होंने बड़े खूबसूरत अंदाज में हमें बताया। डायरेक्टर ऑफ पब्लिक हेल्थ हैं, हेल्थ एंड वेलबींग लैंकाशायर काउंटी काउंसिल, और इन्होंने आज हमसे बात की, और बात करते हुए उन्होंने यही मैसेज दिया कि वो यही चाहते हैं कि आहिस्ता आहिस्ता जो लाइफ है वो बैक टू नॉर्मल हो जाए, लेकिन वो अभी तक हो नहीं रही। सो अब मसला ये है कि ये हम सब का भी फर्ज बनता है कि हम अपनी और अपनी फैमिली को प्रोटेक्ट करें और दूसरों को भी प्रोटेक्ट करें। इसके लिए जो हमारे डायरेक्टर ऑफ पब्लिक हेल्थ एंड लैंकाशायर काउंटी काउंसिल के, उनका मैसेज यही है कि अपने बाकायदगी से 20 सेकंड जो हाथ धोने का मशवरा दिया गया उस पर पूरी तरह अमल करें। जो सोशल डिस्टेंस है उसको कायम रखें। उसके साथ साथ अगर आप बाहर जा रहे हैं, पब्लिक ट्रांसपोर्ट में जा रहे हैं, तो ग्लव्स और मास्क का जरूर इस्तेमाल करें।